You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events.
You too. And joining us for today's media briefing is Tracy Desalvo, the director of the DHS Bureau of Communicable Diseases. We'll talk about our new data on COVID cases, hospitalizations, and deaths by vaccination status. And also available to answer questions is Dr. Ryan Westergaard, the Chief Medical Officer in the DHS Bureau of Communicable Diseases. And we'll begin the briefing with remarks from Tracy Desalvo.
Good afternoon, and thank you for joining us today. Throughout this pandemic, DHS has been committed to transparency in displaying the data that we receive from our 98 local and tribal health departments. And part of that commitment means that we try to present the data in the most complete and meaningful way possible. Data is the tool that drives decisions for public health, and it has remained vitally important to inform our decision-making process throughout the COVID-19 pandemic. As of yesterday, 5,968,354 doses of COVID-19 vaccine have been administered, and 2,927,338 Wisconsinites have completed their vaccine series, which is over half the state. Thank you to everyone who's been vaccinated. Today, we are adding 1,569 new confirmed cases of COVID-19, which brings our total confirmed cases of COVID-19 to 642,969. The 7-day average of new confirmed cases is 1,223, almost 7 times higher than it was just 1 month ago. We are clearly seeing a surge in cases, and with that, we are now seeing a surge in hospitalizations and deaths. There are 3 more Wisconsinites who have died from COVID-19, bringing our total deaths to 7,503. Our thoughts are with the families and friends who have lost a loved one from this deadly virus over the past 16 months. There has been a lot of news circulating recently about vaccine breakthrough cases, and it is important to remember the overwhelming majority of Wisconsin's COVID-19 burden comes from those who are not fully vaccinated. The data show clearly that COVID-19 vaccines are doing their job by preventing severe illness, hospitalization, and death. The COVID-19 vaccines are effective, and getting vaccinated, wearing masks, and following the science will make it possible to protect ourselves and our communities as we move through this current surge. However, because no vaccine is 100% effective in preventing infection, we do expect some infections among fully vaccinated people. And DHS has made several improvements to its COVID-19 data this week, including the launch of a new data page on COVID-19 illness after vaccination. And if you don't mind, I'm going to turn off my camera here momentarily, and I'm going to actually share my screen and walk you through some of those new data pages. And Kelly, it looks like maybe I need you to let me share my screen. All right, so hopefully you all are now seeing some of our DHS web pages, and I am starting out today on our COVID-19 Illness After Vaccination page. And this is actually a new page added to our COVID-19 data pages. So if you're on any of our data pages on the DHS website, you will see that you now have an Illness After Vaccination option here on this menu bar. And what we've really done here is created a new data page that is displaying data showing the rate per 100,000 of COVID-19 cases, hospitalizations, and deaths among fully vaccinated individuals versus people who are not fully vaccinated. And I think as you're looking at this first visual, and this is an infogram, and you can highlight and scroll over and see some interactive features as you're looking at this. But we really want you to see here is the difference in the number of cases, the rate of cases per 100,000 people, as you look at those who are fully vaccinated in blue and those who are not fully vaccinated, which is in the orange and red. And you can see that there are 3 times as many cases in those who are not fully vaccinated as we look at the rate per 100,000. And you see something very similar, about 3.5 times as many hospitalizations in those people who are not fully vaccinated, and then a 10-fold increase in deaths for people who are not fully vaccinated. Certainly encourage you to come to the website and look at this interactive feature. And then there's also added to the website today on this page some data tables that allow you to look at the rate of confirmed and probable cases per 100,000 fully vaccinated or not fully vaccinated people. And you can see cases, hospitalizations, and deaths. There's 3 identical tables as you scroll down the website here, looking at those rates. And I will point out, as you look at these tables in particular, you'll see that June looks much different than the other months. And you'll note also the increasing vaccination percentage over time. So we want to point out that June does look different because of the significantly lower number of cases that were occurring across the whole population of Wisconsin during that month. So please do come here and you can take a look at these different tables as well. And I'll scroll through here. Now you're seeing the hospitalizations. And I can scroll down and let you see the deaths as well. So a lot of really helpful data here for you to take a look at on our website. And we will be updating data on this page by the 15th of every month. And we're going to be doing that update halfway through the month in order to account for the approximately 2-week data lag that we have in getting full data for COVID-19 cases. And the other piece that I want to mention on this page is that this is surveillance data. This is not data on vaccine efficacy. There are very specific kinds of data that CDC and other partners use to evaluate vaccine efficacy. And what we're showing here on our website is actually the surveillance data. And CDC has done some studies and published data recently that show these vaccines are highly effective at preventing severe illness, hospitalization, and death. And of course, I'll also mention that your likelihood of being infected with the virus that causes COVID-19 is determined by many factors, which include vaccination, but also include the level of transmission and vaccine coverage in your community, whether you or others are wearing masks as recommended, the number of people you have close contact with, and more. On average, fully vaccinated individuals are less likely to be infected, hospitalized, and die from COVID-19 as compared to people who are not fully vaccinated. All right, and we're going to move on to our next updated visualization on the DHS website, and this is on the summary data page. And to help local and tribal health departments, schools, school districts, and individuals as well to make important decisions on layering COVID-19 prevention measures in their communities, we've updated our COVID-19 cases and deaths map to align with the CDC case rate definitions that are used to determine the levels of community transmission on the CDC COVID data tracker. And so I'm going to scroll down here to the bottom of the page so you can see our updated GIS maps. We'll let them load. Maybe if I refresh here, we will get recentered on the page. We'll give that just a second. And what you're going to see here as you look at the maps as they get loaded is that the 7-day average case rate is now shown using the 4 colors, blue, yellow, orange, and red, that indicate the different COVID-19 community transmission levels that are used by CDC. And what we've done here is really put our cutoffs in alignment with CDC's case rate definitions that are used to determine the levels of community transmission. And I will point out that the CDC tracker incorporates percent positivity, the percent of SARS-CoV-2 tests that are in the percentage of positive SARS-CoV-2 tests in the past 7 days in their measures of community transmission levels. So these may not always match. The DHS colors may not always exactly match the CDC numbers. And we also have a little bit of different schedules for updating. So if you see some differences, those are the main sort of underlying pieces that are driving that. But one of the really nice features, and I'll zoom in here on Wisconsin just a little bit. One of the really nice features of our map is that you can actually look at our data at the county level, at the school district and census tract level, by municipality, and by zip code tabulation area. So I'm going to show you a couple features here on the map. So as you zoom in, and I'm just going to zoom in on the center of the state here, you can see that we move from seeing just the county level to seeing the census tract level. So you can see some more detailed information locally about what is happening with your transmission levels. And I think really helpful for school districts as they're doing their planning, you can switch over to the school district map view, and we'll give this just a second to get loaded as well. And you're going to see the same color cutoffs that are used here, but you can actually visualize the data then for the school district. And one important piece that I want to mention related to the school district data is that this is incorporating not just the school population, not just the students and teachers at that school, but the entire population of that school district area. So as you look at those confirmed cases, this is looking at everyone who lives within that school district's zone. And you can also, of course, look at city, village, town, zip code tabulation area, using these different tabs at the top. And then I'll also just remind you that we have cumulative case rates, cumulative case counts, and similar data for death that you can visualize using the tabs at the bottom of this map if you're looking for some different views of the data. And finally, last but not least, we've also updated our EpiCurve graph on the cases page to allow users to zoom in on specific segments of data to get a clearer picture. And here we're on the COVID-19 cases page. So if you select from our data pages, you select cases, and the visualization we're going to scroll down to is the second one. And this probably looks very familiar to you. Not a lot of change to the initial view of this, but what we have added here is a date slider. And I'm going to zoom in here just on the last 90 days or so. And you can see this really allows you to visualize the data over smaller time spans and really see what's happening, especially, back in June when we had very low case counts. It's a little bit difficult to visualize that on the bigger chart. So this really lets you zoom in and see what's happening on a more granular basis over time. And here we have that cumulative case count as well. And the same as this has been before, you're able to zoom in, you're able to do your hover to see some specific data about any of the days on this visual. Disease surveillance work is, of course, a dynamic process and continues to be an important part of our COVID-19 response in Wisconsin. And together, we hope these new data and the data enhancements to our existing visualizations really help to illustrate where we are in the pandemic. Again, I want to reiterate that the COVID-19 vaccines are effective, and getting vaccinated, wearing masks, and following the science will make it possible to protect ourselves and our communities and to move Wisconsin forward. And with that, I'm going to turn it back over to Jennifer, and we're going to take some questions.
Thank you, Tracy. And a reminder to maintain audio quality, please keep your phones on mute until it is time to ask your question, because we do need to finish at 1 o'clock. In the interest of time, please only one question per reporter. And we'll begin this afternoon with Charlie Rubeski from Fox 11 in Green Bay. Charlie?
Hi, thank you so much for doing this. I wanted to ask, what is what is the real purpose of providing this new data by the vaccination status? Is it, another push to try to get people vaccinated?
Sure. Of course, we really want to continue to encourage people to get vaccinated. We're happy to say that more than 50% of Wisconsinites are now fully vaccinated. This data really does help to demonstrate the value of vaccines in preventing cases, and especially in preventing those more severe outcomes like hospitalizations and deaths. And so we do want to continue to show people the value of vaccines and really encourage everyone who has not yet been vaccinated to go get their vaccine.
Thank you, Charlie. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey? Again, Casey Nelson. Okay, we'll move on then to Gabriella Rusk from NBC 15 in Madison. Gabriella.
Hi, good morning. My question regards the hospitalizations. I know that we have ICU and then regular hospitalizations data. What is the difference, I guess, in the breakdown for that data? Are there ICU beds? Is this only tracking COVID-19 patients, or is this overall bed use within the state?
That's a great question. There is a separate visualization on the DHS website if you go to our hospitals data tab, where you can see more information about bed use in the state. So that's the place to go for that data. This is actually looking at hospitalization data as reported in the Wisconsin Electronic Disease Surveillance System. So this is based on actual case interviews and their hospitalization status.
Thank you. Now to Mary Jo Ola from TMJ4 in Milwaukee. Mary Jo.
Hi, just wanted to clarify in the new data comparing vaccinated and unvaccinated, or for people who weren't fully vaccinated, does that not fully vaccinated category include people who maybe got their first dose and were waiting for their second dose? Does it include people who maybe got both doses but caught COVID before kind of that 10-day period when you're considered fully vaccinated? Thank you.
Thank you. That's a great question. So for the purposes of this data, fully vaccinated people are people who have gotten one dose in a single dose series or two doses in a two-dose series, and then have had at least 14 days pass since that final dose in their series. So we consider those people to be fully vaccinated. The not fully vaccinated numbers include anyone who is partway through a series or has not yet reached that 14 days past their final dose.
Thank you. And now to Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing the call. Curious if you could, if someone could talk about the number of vaccinated, the breakthrough cases from February compared to July more than doubled, while the number of cases among the unvaccinated appeared to be relatively flat. Is it an incorrect reading of the data to say that the Delta variant is affecting vaccinated people at a higher rate than unvaccinated? I'm just trying to get a handle on why the number of vaccinated cases went up so dramatically while the number among unvaccinated has remained pretty steady.
Hi, I'm not sure I understand the question. The rate among unvaccinated people in Wisconsin has increased dramatically over the past several months, as it has for everybody. So are you specifically speaking about the relative difference that you're seeing?
Yeah, I guess maybe I'm confused by the chart, but when I look at confirmed probable cases for February, among the unvaccinated, it's 385, and in July, it's 369. But among the vaccinated, it went from 56 per 100,000 to 125.
So I think
Sure.
your assessment there is correct. That really is due to the fact that Delta is now the predominantly circulating virus. And we know that, of course, Delta is more easily transmissible, and we are seeing more cases among people who are vaccinated, fully vaccinated with Delta as compared to previous circulating strains of COVID-19. With that being said, I think what's also important to look at here is that we are still seeing much lower rates of cases, much lower rates of hospitalizations, and much lower rates of deaths among those who are fully vaccinated here.
Thank you, Scott. Now to Alex Moe from wisbusiness.com. Alex?
Hi, thank you. Because the Delta variant of COVID-19 is more contagious, is there any concern that a higher percentage of the state will need to be vaccinated in order to reach herd immunity? Thank you.
Yes, that's a good question. That's a general principle when we talk about herd immunity, defined as the level of people who are protected based on their immune status as a threshold that's required for essentially transmission to stop in a community. The more infectious the pathogen, the higher that threshold needs to be. So essentially, everything that we need to do to minimize the spread of the virus, we need to do better and more of when we have a more infectious variant. And that's what we're seeing with Delta. So all that we have the same tools, but we need to implement them much more aggressively to have the same impact on reducing transmission. I think that's why part of the problem that we're in right now is twofold. One is that the virus is much more contagious. And the second thing is that, at least when it comes to physical distancing and mask wearing, by and large across the country, we're doing those things less well than we were at the first half of this year. So I think those are in some ways a perfect storm for why in certain areas of this country and increasingly in Wisconsin, we're seeing a large wave. Now, the vaccination is protective against severe disease and hospitalization at any level of disease transmission. So that's relatively fixed. But if we have more transmission, we're going to see more cases in vaccinated and unvaccinated people. So it's the Delta variant being more transmission changes the game in a number of ways, as you indicated.
Thank you, Alex. Now to Eric Gunn from Wisconsin Examiner. Eric?
Hi, thank you. Two-part question. What's the current information you have about the prospect that children under 11 will be vaccinated soon? And in the meantime, what advice would you have for a parent who may be unable to keep their child home because of work or other difficulties, but is honestly very concerned or about schools' mask optional policy, if that's the case where they are? What would you advise that parent to do to sort of manage that situation? Thank you.
I'd be happy to talk about that one. We don't, for the first part, when will vaccines be authorized for children 11 and under? We don't yet know. We've heard goals that would be by the end of this calendar year, but that is just speculation. It depends on the timely completion of the clinical trials, analysis of those data, submitting those data to the FDA. We've heard people in federal government say that they hoped it would still happen this year, but we can't count on that. So we don't have a firm date on when we would expect that. As to what my advice would be to parents who are concerned, well, the first is, I think we need to reiterate our advice, our strong recommendation to schools, school boards, school leaders, that if we want to make schools as safe as possible, doing so requires we have everyone wear a mask, staff, students, and visitors. With this virus, which is highly transmissible, we need to have 100% mask wearing in school environments if we want to do the best we can to prevent disease spread. And with people dying from this pandemic, it should be in all of our interest to do the things we can to minimize disease spread. And that means requiring masks in school settings. Now, we acknowledge that not all school systems are making those decisions. And we are very respectful of the conversations that people are having, the strong opinions that people are having, and we want to support them with the best information that we can. So in those environments, if someone is not able to make the decision to keep their child home from a school that is not 100% masked, my advice would be, number one, respectfully and actively take part in those conversations to try to increase the safety of our schools by increasing mask use in schools. And second would be to keep children as safe as they can by encouraging their children to wear masks, particularly well-fitting masks that can filter respiratory droplets out of the air. Surgical masks are better than homemade masks. Eye protection is better than no eye protection. So there are things that we can do to minimize the risk to ourselves and our children by wearing masks, but that's only part of the equation. We can make going to school safer by wearing masks on an individual level, but we can't make them as safe as they would be if everyone were wearing masks. So my sense and my plea is that there's still time to make these decisions, to make our schools as safe as we possibly can. Doing so requires masks for everybody inside a school building.
Thank you. And now to Megan Kernan from WBAY-TV in Green Bay. Megan?
Hi there. Thank you so much for taking our questions. I was wondering if someone can provide some more information about the boosters. So when can immunocompromised individuals in Wisconsin get the booster? I know we've heard it's recommended to get the booster of the same vaccine type that people got, but what will that overall process look like? I mean, will it be easy for people to get that same booster as their vaccine? And is the overall importance to get the booster even if they cannot get the same one as their vaccine? And last part with it is, the booster, is it just another dose of the vaccine, or is it a completely different shot, and what those, what the effects will look like with that?
Great questions. Complicated topic. I'm happy to help explain things as best I can. And we've used the terms additional doses or third doses, as well as boosters. And sometimes it's helpful to separate a couple of issues. The first issue is the recommendation for additional doses in people who are immunosuppressed. So this is now a recommendation that is active right now. And what it means is that because we've seen some clinical studies, we have some data that people with weak immune systems don't respond as well to a 2-dose series of an mRNA vaccine. There's a recommendation for people with weak immune systems to go and get a third dose. Essentially, that means their primary series, their vaccination series consists of 3 doses of an mRNA vaccine, the 2-dose series plus an additional dose 28 days later. So that is a recommendation right now. Vaccinators have authorization to give those additional doses to people with weak immune systems right now. And the process is the same as it was for first and second doses. They sign a consent form, they look them up in the registry, they recommend the dose and give the same product. If someone got the Moderna mRNA vaccine for their first 2 series, they should get the Moderna vaccine for their additional dose. So that is that recommendation is now live. The other issue which many people heard about yesterday is the issue of booster doses for the general population, people regardless of whether you have an immune suppressed condition. So that is not currently a recommendation. Right now, we don't recommend people get additional doses or booster doses except for immunocompromised people. But the news release yesterday that came from the federal government, the NIH and the CDC, was that when we're looking at the data, it does seem that the level of protection from vaccines seem to wane over time. And their advice, what they've called for, is to prepare and make a plan for giving booster doses relatively soon, potentially yet this fall. But that will not be a formal recommendation until the data are analyzed by the CDC, scrutinized by the ACIP, which makes recommendations, and then authorized by the FDA. So a lot of discussion and a lot of news coverage yesterday about booster doses was in response to that. The way that they framed it was trying to stay ahead of the virus. We're seeing concerning data that immunity is waning overall. We should be preparing to give booster doses, but that's not a recommendation right now. It's that they're planning for this eventuality, but it's subject to additional steps by the panel of the ACIP to review data and make a formal recommendation. So that second piece about booster doses is not live. The issue about additional doses for immunocompromised people is now active. And we do recommend at this time, people who more than 28 days ago received a 2-dose series of an mRNA vaccine to go get their third vaccine.
Thank you. Now to Peter Culver from WKOW-TV in Madison. Peter?
Hi, one moment. So some people are reaching out to us saying their hesitancy is with the mRNA vaccine, but they would be willing to get a vaccine by Novavax. Do we know where that process stands, and what should people know about the difference between these two?
The Novavax product is not yet authorized by the FDA, so it is not currently an option. It'll still, where it is in the process, we're not exactly sure. I don't have an estimated date on when the FDA would vote or finalize the process to authorize it. It is different from the mRNA vaccines, which are relatively new. The mRNA vaccines use a segment of genetic material, which gets essentially translated by the vaccinated person's cellular machinery to create the protein that causes the immune response. The Novavax vaccine, similar to other vaccines, gives the protein as part of the vaccine. So it's a recombinant protein vaccine, which is more similar to traditional vaccines. So the difference really lies in the mechanism at the cellular level. The data suggests high levels of protectiveness and safety for the mRNA vaccines. And there's obviously very much less data on the Novavax vaccine, but it's been, from what we've heard, sufficient to move forward in the process. And it's still, as far as I've heard, still planning to go through the process for emergency use authorization, but it will not be available for use until that process plays out.
Thank you. Now to Will Cushman from Wisconsin.
Hi there. I am wondering if you are able to and have been tracking demographic data related to breakthrough infections and hospitalizations and deaths. I'm curious both kind of in whether there is a difference that you're seeing in the rate of breakthrough infections by age, and or whether kind of similar risk factors for serious disease and death, such as age, remain the case among breakthrough infections in fully vaccinated people. Thank you.
Thanks, Will. Because these data are from the Wisconsin Electronic Disease Surveillance System, or WEDS, we do have demographic data on these cases, and we are actually looking at some possibilities of showing some different age data in the future. So something to potentially look forward to on the DHS website as we continue to think through how we best display the data and make sure we're accurately telling the story of what's happening in Wisconsin.
Thank you. Now to Danielle Kading from Wisconsin Public Radio. Danielle? And a reminder, *6 unmutes your phone. Danielle Kading from Wisconsin Public Radio.
Hi, Danielle here. I have a two-part question for you. I'm wondering if you can tell me whether you expect case rates to rise among vaccinated people, given what we're seeing. And then secondly, do you expect case rates to go down once people who are vaccinated already get a booster shot?
So I think Tracy had addressed that question pretty well in her introduction, which is that what determines whether case rates on a population go up or down are subject to many, many factors. The vaccine coverage and vaccine effectiveness are an important part of those, but the general intensity of transmission in the community, the number of cases are now, and the degree to which people are in close contact are really what's going to drive that. So we are very hopeful that as we vaccinate more people, we'll have fewer cases in vaccinated people and fewer cases in unvaccinated people. But we have to do things right in order to achieve that. And that's why we're seeing more calls for indoor mask wearing. But we're bracing for the pandemic to get worse. And when there's widespread transmission in the community, it's going to affect unvaccinated people at a much higher level. But when we have large numbers of fully vaccinated people, we are going to see cases in that group as well. So the message is, yes, if the pandemic is heating up, if there's more cases everywhere, it's going to affect both vaccinated and unvaccinated people, although much more, to a much greater degree, people who are not protected by vaccines. But I think the other message here is that vaccines are, our highest impact tool. It's only one tool. The other things that we need to do to minimize transmission is the behaviors that we engage in. So, limiting gatherings, wearing a mask when you're indoors, organizations coming together and requiring masks, and where appropriate mandating vaccines. Like, all of these things are going to increase our chances of minimizing this surge, which we're in right now. And we have some control of whether this surge, how high the peak is going to be and how long it's going to last. Those things are really complicated, but we need to use all the tools we have to try to get out of this as soon as we can.
Thank you. Now to Sean Kirkby from Wisconsin Health News. Sean.
Hi, thanks for holding this. To follow up on some of the immunocompromised questions, do you know how many people would be eligible in the state who are immunocompromised for that third shot? And are you planning to report any data on third COVID-19 shots? Thanks.
So the estimate of the general population that has one of the conditions that ACIP indicated are third doses are necessary for is about 3%. And that's likely true generally for the state of Wisconsin as it is nationally. And the second part, yes, we are tracking third doses and using the same system and procedures that we track first and second doses through the Wisconsin Immunization Registry. So we will be able to track how frequently those additional doses are administered.
Thank you, Sean. Now to Rose Schmidt from CBS 58 in Milwaukee. Rose?
Hi, thank you for taking my question. I guess going forward, you kind of touched on this before, but does Wisconsin have plans for mass vaccine sites for booster shots in a few months as those details you kind of become more available? And at the same time, how will you juggle that, the boosters, with the people who are still getting their original doses, considering we're only at the 50% fully vaccinated number that we reached last week? How will you kind of juggle the boosters with the original doses and, trying to continue to persuade people who still haven't gotten their first and second doses? Thanks.
Yeah, thanks. Those are important policy questions. I think the signal from the federal government yesterday is that yes, start planning this. And we have a very hardworking, although very tired, team of planners and logistics experts and partners in state and local government and other sectors that, in the same way that they tried to create infrastructure to administer first and second doses, will do the same things and try to maximize our use of resources to make those other doses available. And those details will be forthcoming as our planning and policy people develop those plans.
Thank you. Now to Mitchell Schmidt from Wisconsin State Journal. Mitchell. Mitchell Schmidt, Wisconsin State Journal. Okay, moving on then to Kent Wayne Scott from WISN TV in Milwaukee. Kent? And a reminder, *6 unmutes your phone. Kent Wayne Scott from WISN. Okay, well then our final question of the afternoon belongs to Jason Calvi from Fox 6 in Milwaukee. Jason?
Thank you for taking my call. Back to the issue of the booster shots, as the federal government says to get that plan in place for those booster shots, distribution at least. I know you had mentioned a little bit about the plans, but can you give a little bit more specifics into the plans underway? And do you expect that you'll be bringing back those mass vaccination sites across the state as well?
Yeah, I'm sorry, I can't speak to that. I think we'll, I trust that our state and local planners and policy people will use the resources that we have in the best ways that we can, but we don't know what the plan's going to look like yet.
Hi, this is Kent. Can you hear me now?
Yes, we can. Go ahead, Ken.
Okay, yeah, I apologize for the problem on my end, and thanks for this. I just want to follow up real quickly on the, you pointed out the increase in breakthrough cases, positive infection cases among vaccinated people due to the Delta variant. Many of these people, because they're not being hospitalized, may be asymptomatic or have mild symptoms, they may not be getting tested. As a result, is it possible that this could be more widespread in Wisconsin than the numbers indicate, and that those people could still be transmitting the virus?
Well, I'd say, and Tracy, you can weigh in if you have other perspectives. So I think it's generally true of vaccinated and unvaccinated cases that we tend to undertest them. That's been really the most, I would say, devastating aspect of this virus, is its ability to cause infection and be highly transmissible before symptoms start, or if in the absence of any symptoms. So every statistic we've ever had about cases is representing a tip of the iceberg. And when we try to quantify or study the number of cases that occur relative, in vaccinated or unvaccinated cases, there's going to be subject to underreporting. So that's why I think that this approach to that is to study the issue from different perspectives in different settings that are subject to different kinds of biases. And there are studies like that looking in, for example, long-term care facilities where testing happens as a matter of routine. So it takes away some of that testing bias. In hospitalized patients, when people come in with symptoms, there's standardized testing. So that we have to look at it from different dimensions in order to get an accurate picture. And that was another important point that Tracy made, is when we're trying to make conclusions about how well our vaccines are working, we can't just look at surveillance data. We can't just look at raw numbers, because it's confounded by many factors, some of which you alluded to. We need to look at well-conducted studies in different settings using different methods. And right now, a multitude of studies are showing the same thing, which is that breakthrough cases in fully vaccinated people happen. The risk is dramatically lower in vaccinated people than in unvaccinated people, and it's particularly lower among when we talk about hospitalizations and severe cases and deaths. So there's not a simple answer to the question, but I think that the data are all pointing in the right direction and supporting our top level recommendation that we'll all be better off if we can get as many people to get vaccinated as soon as possible.
Thank you. And that will conclude today's briefing. Our thanks to Tracy Desalvo and Dr. Ryan Westergaard of the DHS Bureau of Communicable Diseases. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsinite, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsinite is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.